Yes, we are disrupting normal programming, and we're going to talk about something very critical. Tomorrow is International World Women's Day, and I think we need to discuss some issues about women. So, before we go into the straight discussion, let's have this preface. The International Women's Day is celebrated in many countries around the world as a day when women are recognized for their achievements without regard to divisions, whether national, ethnic, linguistic, cultural, economic, or political. International Women's Day first emerged from the activities of labor movements at the turn of the 20th century in North America and across Europe. Since those early years, International Women's Day has assumed a new global dimension for women in developed and developing countries alike.
Women and girls all over the world.
We are here this evening to celebrate the women on whose shoulders we stand.
The government of Uganda has had success in domesticating global gender norms alongside inconsistencies between policy statements and the ways in which plans are implemented. By early 2000, Uganda had established policies and legislation to advance gender equality. Article 33(6) of the 1995 Constitution prohibits laws, customs or traditions which are against the dignity, welfare or interest of women. The Constitution states that men and women are equal before and under the law, and where gender inequalities exist, the Constitution provides for the implementation of affirmative measures to address these imbalances. In the last few years, protection of women's and girls' rights have been put in place, namely the 2010 Law on Domestic Violence and the 2011 Domestic Violence Regulations, the Anti-Genital Mutilation Act of 2010, the Anti-Trafficking in Persons Act of 2009, and the Equal Opportunities Commission Act in 2007. Despite these efforts by the government of Uganda, there are so many areas that need desperate attention as to better the status of women in this country. In line with today's discussion, we seek to critically fix our focus on two areas that require urgent redress. These are the worrisome gender-based violence against women and the related consequences of aggravating HIV, stroke, AIDS infections amongst those GBV-affected women. Violence against women and girls constitutes a major obstacle to the empowerment of women. According to the 2012 Uganda Domestic Health Survey, 56% of women aged between 15 to 49 have experienced physical violence at least once since age 15. One of the factors behind this high prevalence rate is the widespread cultural acceptance of such violence. According to the Uganda Police Force 2014 Annual Crime Report, defilement is the third most common crime reported to the police. However, the conviction rate for rape and defilement cases stands at 0.8% and 1.8% only, respectively. On top of the multitudinous stakeholder efforts undertaken by government and several other civil society organizations in assuaging the plight of women suffering from violence and HIV/AIDS, a particular community organization in Uganda called Reach Out Mbuya is helping to pragmatically provide solutions. NTV, in partnership with Reach Out Mbuya HIV/AIDS initiative, bring to you this discussion on how we can take stock of the progress made on women's right to health, how to combat gender-based violence, and reduce HIV/AIDS infections. Follow and engage with us on this discussion on our Facebook and Twitter platforms. You are welcome. Thank you for joining us in this beautiful afternoon here in Kampala. Of course, all over the country and all over the world, we are disrupting our normal programming. And so let's discuss this issue concerning women, the gender-based violence, and of course, the repercussion that comes at when those women are abused or violated, they actually get to be easily susceptible to HIV/AIDS infection. In the studio, I have great partner, resplendent ladies who have joined us in support of this discussion, and they're coming from Reach Out Mbuya AIDS HIV initiative. And on my extreme left, I have the lady called Cinderella, the Strategic Development Officer, Reach Out Mbuya organization. Cinderella, you're welcome.
Thank you very much.
Okay. Sometimes you cut your name to Cindy.
Yes, yeah? Cindy is okay.
All right, so I can use Cindy along the way. And just in the middle, next to me, is Sylvia Nambozo, Orphans and Vulnerable Children Supervisor, still Reach Out Mbuya organization. Sylvia, welcome.
Thank you. It's Nambozo,
Nambozo.
from Eastern Uganda.
All right.
Thank you very much.
Apologies on that particular misspell of your name. So let's go straight into the discussion. Cinderella, first of all, just for purposes of respecting your partnership here, so give us just an overview of what Reach Out does and how far you've gone with dealing with your mandate as an organization.
So Reach Out Mbuya Parish HIV/AIDS Initiative is a community-based, faith-based organization. Reach Out was started in 2001. Our organization started with just 14 clients. We are affiliated to Our Lady of Africa Mbuya Catholic Church, and our operations are in the catchment areas where we have slum and less privileged members of our communities. In Kampala, we are operating in Nakawa Division, areas like Acholi Quarters, Kasokoso, Banda, and other areas surrounding Kampala. We also operate in Wakiso, Nakasongola, Nakaseke, and Luwero. Reach Out Mbuya is a direct service provider for HIV/AIDS services. We operate in cooperation with the Ministry of Health and other development partners. Now, since 2001, Reach Out has served more than 10,000 clients. That means we've provided direct service provision to persons directly affected by HIV/AIDS. That means clients who are positive and enrolled in care. We do also support other members of that household affected by HIV/AIDS. And since inception, we've served more than 15,000 orphans and vulnerable children. Now, a couple of these children emerge from vulnerable households. And at Reach Out, we care about the less privileged members of society.
So when you say vulnerable households, what do you mean?
Vulnerable households, so in line with operations of Ministry of Gender, Labour and Social Development, we have criteria to determine vulnerability of a household. And one of those key issues in the core assessment points is HIV/AIDS. So when you have a typical household that has been raided by AIDS, we know the epidemic has been in this country for quite a while, and it has ravaged so much of the social fabric. So at Reach Out Mbuya, a typical vulnerable household is that household that lives on less than $1 a day, that household whose head or member is directly affected by HIV, that means they're HIV positive. In the same household, you find a member who is in need. That means they're unable to meet their core social service areas. Yes.
So your vision states that you're community free. You want a community free of the spread of HIV, where those persons already infected and affected by HIV are living positively with an improved quality of life.
Yes.
So do you feel you're actually meeting that mandate, that kind of aspiration in that vision?
Globally, we're fighting hard to end AIDS by 2030. And Reach Out Mbuya is one of those organizations that are striving to end AIDS. So in our mission, every day we work hard to ensure that all our communities are free of AIDS.
Good.
And I'm happy to highlight that the first client to benefit from the PEPFAR, USAID PEPFAR funding for antiretroviral treatment is a Reach Out Mbuya client.
Yeah, the PEPFAR, which was initiated by President George W. Bush.
Okay,
thank you, Cinderella. Let me come to Sylvia. So, Sylvia, with the prevalence of HIV, people living with HIV in 2015 here in Uganda, we're about 7.1% of course, the entire population, okay? And globally, it was 1.5 million of those people. And so we're asking ourselves, there are so many efforts that have been put underway by a multitude of interveners, including central government, including global players. Our current programs, these interventions that are being done, really effective? Are they working? What is your prognosis about this whole thing?
The efforts that have been put in place, both globally and nationally, are working. We can see results. As we speak now, for example, as Reach Out, we boast over zero transmission of mother to child, a program that was spearheaded by our First Lady, Mama Janet. That is evidence that the efforts are working. If you're having zero transmission of mother to child of HIV, then that shows you that efforts are absolutely working. In the past, we had very few people accessing antiretroviral treatment, but now with availability of funding from the US government and the many CSOs all over the country. Services have been taken closer to people that need them. And now we are striving to achieve our dream of the 90-90 because the services have been brought closer to the people. So I totally confirm that these efforts are working, and the Ministry of Health is taking lead to corroborate these efforts, where we regularly meet as stakeholders to share information on statistics and who are most affected. As we know right now, girls and women between 19 and 49 are most affected by the virus, and efforts are targeting such people. But we're also cognizant of the fact that men are missing out on HIV prevention and response. So CSOs and government is tasking all partners to ensure that men are brought on board so that we can achieve the 90-90-90.
So
target.
you imply that the disinvolvement of men in the arena of fighting against HIV and AIDS is the one which generated the population of 1.5 million in Uganda to be HIV infected. Because 1.5 million people having HIV in a country like ours, which is just literally about 4.4 million and something, 40 million and something, is quite worrisome.
It is.
So are you saying the men are the problem or the intervention?
No. Initially, if you knew, the HIV interventions were concentrated in urban areas initially. And there were many myths surrounding HIV. Many people thought this was a traditional issue, you know, and they had different interpretations. But with sensitization, massive one at that, and availability of these drugs, we've been able to disapprove some of these myths, and people have been able to come out and receive these services. But also the pioneers, we've used peers, people who are able to come out and speak about their HIV status. So initially there were issues of stigma, but also lack of information. People did not have sufficient information about HIV, but all this is being addressed. So we cannot just tailor it down to only men.
All right, just 2 minutes. What is your take on that, Cindy?
Engaging men and boys is critical in addressing HIV/AIDS because both men and women contribute to the transmission of HIV/AIDS, and that means at the heart of our response, we must look to ensure that HIV prevention messages reach to these men, because the men don't live in isolation, and so are the women. In terms of treatment and care, at Reach Out Mbuya, we do not engage these women in isolation. We have a holistic mode of care that looks at the individual in relation to their family. And the bulk of our intervention in reaching out to men is in a way that we go to find the men. We go to the places where these men drink alcohol. We go to the places where they work. We go to the places where they do other co-curricular activities. And because it's comfortable for men to meet their peers where they are, we find it an effective way to reach out to men where they are, because then you will reach in their comfortable places and get them tested and get them with the messages for HIV prevention and response.
Okay.
Yeah.
Now, Sylvia. Yeah. Just again, of course, you touched on the issue of the 1990 agenda. So the United Nations AIDS Commission or agency set up a dream, a big kind of aspiration, saying that they needed the HIV epidemic to be eradicated by 2030, between 2030 and 2040, and they set up a 90-90-90 ambitious treatment target to help end the HIV/AIDS epidemic. So implying that by 2020, 90% of all people living with HIV will know their HIV status, that by 2020, 90% of all people will be diagnosed, rather with diagnosed HIV infection will receive sustained antiretroviral therapy, and same, by 2020, 90% of all people receiving antiretroviral therapy will have viral suppression.
True.
So the government of Uganda committed to this. We're asking ourselves, was this commitment really something that was just an excessive excitement to it, or it's a realistic commitment that we can be able to have realized in our own country that by 2030, 2030 actually we have eliminated HIV in 2030, 2020 we have this 90-90-90 treatment target?
The 90-90 target, I think, is very realistic, and I think it was worthwhile for government to commit to this, because the major challenge we're having is people not being able to know their HIV status and being diagnosed late, and often cases we were losing some people because of that, because by the time they seek your services they have full-blown HIV. And for your information, as we speak now, the target is being revised to 95, 95, 95.
But
that is not official. Yes, because from the information that we are sharing as partners coordinated by the Ministry of Health, we realize that the target is achievable. And what does it mean for us? So is it
revised locally, or you're talking about
no,
the UNAs?
It's globally.
That's the chart that
it is globally, because it was set globally, so if it's in the process of being revised globally as well. I think it is very important and timely that we get to target our efforts, because initially it was just about testing, let people find out their HIV status. But what we are doing right now is targeted testing. Can you go and look for the people who will test HIV positive? And then research shows you that the people who are most at risk are commercial sex workers. They are the married people. They are the young girls, the women. So our efforts now are targeted. We do not just go and stage up HIV testing services out of the blue, but we use information, we use peers to reach out to the people that we think will yield the positive results, because we think that it's important that we reach these in order to put them on treatment and reduce their virus suppression, because as long as they are not on treatment, then they will be able to pass on the virus to other people. They will not be able to achieve this dream. Yes.
Cindy, you take on that?
Yeah,
do you think really this aspiration is achievable, in as much as she's reporting about something we had not actually come across? There's even a revision to put it to 95%, implying that by 2020, you're looking at the treatment coverage of 95% of all these particular areas. When you are going through your work, do you see that actually the government, the collective effort, both the government and the civil society organizations, is it driving to that?
Yes, it is driving to that. The 90-90-90 targets are just a way of us ensuring that our efforts to epidemic control is a sustained effort and a focused effort. Let's look at the third 90, where we're aiming at viral load suppression. A recent study by Uganda population-based
So viral
HIV.
load suppression, please let's not assume that all our viewers understand.
The third 90 looks at ensuring that those who are on treatment and have the amount of HIV/AIDS virus
that is
in
the
their
viral
blood,
load.
is suppressed,
Yes.
is reduced, meaning the transmission rate for HIV/AIDS is reduced. So we look at the third 90, and that's where the issue of violence comes in for women.
Which we're going to deal with.
Which we're going to deal with at a later stage. But for me, the incredible effort that Ministry of Health and government is thinking, we raise our targets to 95, 95, 95, is critical. That means in the first place that we've made great strides in doing all of this, in achieving the targets. And again, in our programming, all of these first 90, second 90, and third 90, we care about them, we address them, and we do not do all our interventions in isolation. Yes.
Okay, just lastly, in a minute, Sylvia, the diagnosed, the second 90% kind of target, which is ensuring that all people with diagnosed HIV infection receive sustained antiretroviral therapy. Do we have the resources to ensure that that actually is done? Are you seeing that there is an investment in this area and the funding is sufficient?
Absolutely. There is funding. Of course, we know that as a government, we get support from international donors. And I like to credit the US government on this, because they've greatly supported us in this area. And I can assure you that for most of the hospitals in Uganda, we hardly have any stockouts of HIV, of antiretroviral drugs. So it is something that can be achieved, but also the government and also the civil society organizations are also tapping into the private companies that are willing to support. As you saw recently, we saw the UN team visiting the Saudi prince to lobby for resources for such activities. So with support from Ministry of Health and with support from international donors, it is possible, because we have seen that we are able to provide drugs for those that need them in most of the hospitals that are being strengthened by the different CSOs and Ministry of Government. So it's achievable.
Okay, pretty a good picture that indeed you're painting, and I believe we have progress based on the facts that we're dealing with here. And thanks our viewers for keeping with us. We're going to go for a break, and when we return, we're going to deal with the issue of gender-based violence and how it affects women and actually exacerbates their vulnerability to attract HIV and get AIDS infection. We'll be right back after this short break.
I'm helping Ugandans make the smart choice. Why choose this powder?
It cleans just like any other ordinary detergent.
Ariel gives you better stain removal in one wash, even with less powder.
It can't be.
Observe grass, tea, and chocolate drink.
I'll need 2 handfuls.
And just 1 handful of Ariel. See? Better stain removal with only 1 wash.
It's the smart choice for sure.
Ariel removes tough stains in 1 wash.
Do you wanna dance?
It all started 5 years ago.
Batman, Scoop, Crook Clan, Timberland.
It took the country by storm. Dance was redefined, and now the return of Hot Steps. If you're born to dance, send us your audition video. Hot Steps Season 5. Hot as it sounds.
Teens are taking over. Fanta marketing.
Raise the praise. Get inspiration. Rise up every morning with a song of praise to the Lord.
Your love is high, higher than my hopes, it's strong, stronger than my past, it's more.
A day in your courts is better than 1,000 elsewhere. Soul Moment, every Monday to Friday at 6 a.m.
We set out to find the next big thing in showbiz. We called for entries, you responded, and we are getting there to the next beat presenter. The search is finally down to the top 9 from a pool of 100 applicants. Mbabazi Akram, Tracy Kabito, Sami Wetala, Hakim George, Esko Chizito, Andy Gavi, Dagi Nice, Crystal Panda, and Eugenia Langa. It's the road to the next beat presenter. Watch the top 9 as they hustle it out on the beat to be the next beat presenter. Every day we will showcase one prospectus presenter on the beat for you to choose who the next presenter should be. It's time to vote. Go down to your messages, type beat, leave a space, I vote for, leave a space, type the name of your favorite contestant and send to 6565. Alternatively, go to the NTV The Beat Facebook page, look for the next beat presenter poll and vote for your favorite contestant. Remember, your vote counts. May the best presenter win.
Just to see the efforts of what Reach Out is doing, of course, in consonance with what we are discussing about HIV interventions and ensuring that we reduce the devastating behavior of people violently abusing women. Let's have this just clip and you understand what they're doing.
Reach Out, in my eyes, is a totally community-based program in every sense of the word. We are living within our community. Our patients are, or clients, as I like to think of them, are all from here. And so we know each other and we help each other, not only with the medical issues, but when you work with poor people, you really have to look at the whole part of the family as well, of the food and how they can participate in the community.
Reach Out is a faith-based organization, and it started in this place of Mbuya. It started in this church way back in the year 2000. The situation of HIV/AIDS in the whole country was very, very bad.
I came to Uganda in January 2001. I first time met Father Joseph Aketi, the parish priest of Mbuya parish. He said, I want to meet you, doctor, because I'm giving the last sacraments to people in the community, and 2 months later they are up singing in the choir. What is happening? And what was really happening was that because of people were not dying of their HIV/AIDS per se, but the opportunistic infections, which we could treat. And Father did then the beautiful thing that he invited us to come and make a clinic in the church. And that was just in the bottom under the church, the proper church, a couple of rooms, and we could start cleaning.
Thanks for keeping us here at NTV as your #1 station. We're coming live to you from the Kampala International Conference Center. So, and please, let's just continue engaging in the discussion. Now, Cinderella, there is the issue of gender-based violence that we had to first resolve as we were discussing AIDS. And one of the biggest difficulties that have been in place, of course, till 2016, is data provision. The availability of that data was notoriously very difficult. However, of course, we currently now have the Uganda National GBV database, which is a function and innovative system currently operating in 73 districts. It's been reported because when there was a status of women conference in 2016 in New York, it was unveiled, and the countries there, they committed to actually sponsor it. So currently the database is able to collect real-time, highly disaggregated data on GBV from a variety of public sources. And at the moment, between January 2014, not at the moment actually, between January 2014 and October 2016, there were recorded 16,500 GBV cases. And 81% of those survivors were women, which is incredibly saddening, and 19% were men. So let's just understand this. How should it be even conceivable or still existent that women are suffering this kind of mistreatment and plight, the gender-based violence?
Gender-based violence affects women and girls quite much. Like you've highlighted, I think of the 16,000, more than double this number could be unreported cases of violence.
Yeah, exactly. And that was just 2016.
Yeah, have been unreported. Women's rights have been violated. The various forms of violence that really affects women. We have sexual violence, we have physical violence, emotional and economic violence. And at the heart of our programming, we care about ensuring that all women realize their full potential. Just to let you know that adolescent girls and young women, which is, part of the broader constituency of women, are one of those highly impacted by HIV/AIDS. And one of the causes of this is that these girls are exposed to violence, like sexual violence. We've had cases of rape, we've had cases of defilement, we've had cases of commercial sex work. And so all these exposures, while these women are struggling to survive, they're exposed to violence. And just again to highlight, we know that violence has really affected the realization of women's rights to health. And because of this, sometimes we don't have these mechanisms for women to use to report these cases, and they suffer in silence. And as we press for progress in this Women's Month or Women's Week, that we are trying to see how best can we transform the lives of women, for me, I believe that we need to target our interventions to ensure that all women are on board, whether women in the rural areas or women in urban settings, women in middle class, young, all women alike. All of them have unique needs and challenges. And addressing them means that we listen to them. We go where they are. At Reach Out, we do have expert clients. And we pick out, for example, the mother-to-mother supporters. These are HIV/AIDS affected women. We pick them, train them, and use their skills and commitment to reach out to other women, to be able to open up and receive services, receive support, and be better, able to lead their lives. Yeah. Okay,
tremendous. And so do you feel that we're on the right course and like optimistically, actually, this will go down?
Progress has been made, but we cannot neglect the fact that there are still, pressing needs. One of those is, poverty. And the bulk of women live in rural areas and are struggling day and night with so many needs to meet. We're seeing some gender norms, heightening the risk of women. We talked recently about this issue that we have men who do not provide for their families, and they leave these women suffering. A lot still needs to be done to improve, the lives of women. Okay, thank you. Well articulated, and at least I believe with one of these particular efforts of discussing this, people out there are going to make sure that they take serious caution and commitment to ensure that this is reduced, this kind of gender-based violence. So now, Sylvia, according to UNA's study published in 2004 and it was conducted from South Africa, it highlights that about 1,366 South African women attended health centers in Soweto and agreed to be tested for HIV and interviewed about their home lives. After being adjusted for factors that could distort their outcome, the figures showed that women who were bitten by their husbands or boyfriends were 48% more likely to become infected by HIV than those who were not. And a similar study was done in Tanzania. So what is the nexus? Why would it be that the person who is battered and is this vulnerable actually is also more susceptible to HIV infection? What is the nexus in between these two factors?
Well, research, like you've said, shows the correlation between the two, HIV and gender-based violence. Where we see HIV leading to gender-based violence, but also gender-based violence leading to HIV. How? Like you've given a good example of battered ladies. One could get HIV because there is contact. It could be exchange of blood. They could get HIV through that. Where we have a client who fought with her husband and got HIV through that. But also we have seen scenarios where women who are in abusive relationships are not comfortable to come out and receive HIV services because of fear of being beaten or being isolated. But also when we look at the people living with HIV, even those who have been able to come out, test and receive treatment, they still receive enormous stigmatization and discrimination in their communities, which sometimes hinders the efforts in HIV prevention, treatment, and viral suppression. You know, if someone will be blamed and be criticized for seeking treatment, then they rather not. But look at a mother who is constantly being beaten, and probably she's pregnant. She may not seek treatment, and what will happen? She's likely to pass on HIV to her unborn child, which then frustrates the efforts of our dream of the 1990. So it is very important that we recognize the fact that HIV and gender-based violence are related, but then HIV does not exist in isolation. There are many factors surrounding HIV, and we cannot think that by merely testing and providing people with antiretroviral treatment, it is enough for us to achieve viral suppression and achieve our big dream of the 390s. But it's important that we address all these other factors. Can we look at gender-based violence? What is causing it? Cindy talked about poverty. Yes, but there are also society norms that put men way above women and look at women as property. Now, a woman will need to consult her husband on everything. We have seen women who walk into our clinic and test for HIV. They test positive, but cannot go home and disclose these results. And this frustrates the HIV efforts, because if she cannot disclose to her partner, then she's exactly. But also he could be living with HIV but has not tested. Then she will be reinfected. Much as she's on treatment, she will be reinfected by her husband who is not on treatment. So it's important that we recognize all these other factors, GBV inclusive, that affect efforts in HIV. It could be nutrition. If our people do not have enough food, then they will not even bother to swallow the drugs. They will tell you, I cannot take those strong medications on an empty stomach. So they will shun the treatment. And what will happen? The virus will increase. And before we realize it, they are spreading it, but they could be also losing their lives. So it is important, but like Cinderella mentioned, when it comes to sexual violence or issues of violence, people do not want to come out and speak. But you also pity the ladies. Most of them rely on their husbands for economic survival. So we have worked with the Family and Child Protection Unit of Police, where they tell you women come and report gender-based violence, but they will just stop at telling you, I came to report this case, but do not summon my husband, let's not talk about it. But just in case something happens to me, you know that my husband has been battering me. Now that frustrates your interventions, because without her consent, you cannot summon her husband, and then she will continue being battered. You know, and then she will not seek treatment. Or if she's getting the treatment, she may not be free to swallow her antiretroviral treatment, you know. So it is important for people to come out, but it's also collective effort that we address these issues. It's not just about reaching out to the women. Yes, we will sensitize, but what have we put in place to make sure that those who already are experiencing violence can receive the necessary support? How can they be treated for the wounds that they sustain? If a girl has been defiled, can she be able to access the post-exposure prophylaxis so that we can contain the virus within 72 hours and save her life, you know? So all these efforts need to be put in place. Without that, we'll not achieve this dream.
Yeah, well, yeah, tremendously well said. And the good thing you're doing something. So Cindy,
yes,
just in a couple of minutes, what exactly actually are you doing, just in supplementation of what the video introduction was doing, as reach out to make practical intervention in this particular area of HIV infection and, of course, the abuse of women?
At Reach Out Mbuya, we do utilize the gender transformative intervention model. And that means at the heart of our intervention, we look at men and women as partners in addressing violence issues. Our response and prevention takes into consideration that we engage men and boys, just like women and girls. And recently we've had a number of GBV awareness days where we go into the communities and sensitize people and create this awareness of their rights, of where to report cases of violence, and how we as Reach Out work in a continuum of a range of service providers to address these issues. So we do work with police, we have a strong network of LC1 chairpersons across Nakawa division. And these LCs, as a sustainable model, we've empowered them to identify cases of violence, and they simply alert us, and that's where we come in to provide the support. But also, all our clinical and medical teams have been trained, and that means they do not only have the medical lens to look at an HIV/AIDS or health issue for any woman walking in for service, but they also have the gender lens. We've done trainings on gender norms, and so they're able to detect any case of violence that has happened. And in the way we are doing work, for me, I feel we're trying to, reduce the cases of these violence issues affecting achieving the 90-90 goals. Like I mentioned, the third 90 cannot be achieved. We cannot reduce viral load suppression if we do not deal with underlying issues in communities. We cannot ensure any woman lives and gets to her full potential if we don't listen to these women. If they have violence issues at homes, we have a strong community network that goes in to speak to these women. We do village meetings where we listen and get feedback. And through, building that relationship with our clients, with women and girls whom we work with, we get sustained impact, we get incredible results, we get to meet their needs in a comprehensive way.
Okay, thank you so much. Let's go for a break and then come back and just see how we broadly summarize on this particular matter. But so far, pretty comprehensive and informative. Thank you, our viewers. Just after this short break, we'll be back.
We set out to find the next big thing in showbiz. We called for entries, you responded, and we are getting there to the next beat presenter. The search is finally down to the top 9 from a pool of 100 applicants. Mbabazi Akram, Tracy Kabito, Sami Wetala, Hakim George, Esko Chizito, Andy Gavi, Dagi Nice, Crystal Panda, and Eugenia Langa. It's the road to the next beat presenter. Watch the top 9 as they hustle it out on the beat to be the next beat presenter. Every day we will showcase one prospectus presenter on the beat for you to choose who the next presenter should be. It's time to vote. Go down to your messages, type beat, leave a space, I vote for, leave a space, type the name of your favorite contestant and send to 6565. Alternatively, go to the NTV The Beat Facebook page, look for the next beat presenter poll and vote for your favorite contestant. Remember, your vote counts. May the best presenter win.
Do you wanna dance?
It all started 5 years ago.
Batman, Scoop, Crook Clan, Timberland.
It took the country by storm. Dance was redefined, and now the return of Hot Steps. If you're born to dance, send us your audition video. Hot Steps Season 5. Hot as it sounds.
One thing I like about Ugandan people, they love what is worth their money.
You look good tonight.
Log in for the glitz and glamour.
I don't want to say there's any extra about me. I'll just simply say I thank God for everything that happens in my life.
The pomp and the most flamboyant people and events.
I'm not going to say we lost. We are on the same team, meanwhile. We won. Vinka the boss man, and you're watching Login Extra.
To some people, singing is a career. To me, singing is a hobby.
Every Wednesday, 8:05 p.m.
Love everybody, straight away. Love you, Tina.
For some reason, your boyfriend calls me his worst nightmare.
I have no
boyfriend, guys. Disclaimer.
Log in extra every Wednesday, 8:05 p.m. only on NTV.
Just before we close, let's see again what Reach Out is doing in this particular clip, just to emphasize what also the rest of us in society really need to intervene in these two areas of HIV and GBV.
Reach Out has a niche in this society, and it has been targeting the poorest of the poor and going out to them. The community approach that Reach Out has been a unique approach. Not only do they find the clients in their homes, but they follow up and link up. There's a linkage between the community and the facilities. We have 3 facilities in Kampala, here at Mbuya, one at Chinawataka, and the other one at Banda. The community department is very important in Reach Out's program because we work with the community and we support each other. Reach Out provides treatment, yes, but we know that the environment around the individual affects the uptake of the drugs. So we go out to the community to ensure that the clients are supported. We have village meetings where we hold dialogue meetings with community members to find out what are the challenges they are facing and what are the new issues that are cropping up that we need to address. So the community aspect ensures that the client receives holistic service.
Thank you, our viewers, for keeping with us and keeping us as your #1 station. This is NTV, and we're discussing GBV, HIV/AIDS relation, and how we can indeed decrease or combat this. So, Sylvia, just help us, just as we're wrapping up this whole discussion, what other measures, practical measures, are needed to ensure that we increase the rate or simply escalate the efforts of rather the intervention measures to reduce or just curtail this particular problem?
Okay, in addressing gender-based violence in relation to HIV, it is very important that we start with the ordinary person. If it is girls and women, as highlighted by statistics, that are most affected by these two major issues, it is important that we design programs that empower them. One, they need to know that they have rights, you know, and they need to know the risks at hand. But most importantly, they need to know how to prevent gender-based violence and HIV. You can prevent HIV by, first of all, knowing your HIV status. And if you're positive, of course, the health workers will enroll you on treatment and support you through your treatment. If you're HIV negative, they will still provide you with information on how to remain negative for the rest of your life. And then for those who are HIV positive, they need to know that it's not a death sentence. Life goes on after HIV. An HIV positive mother can give birth to an HIV negative baby. And then we need to also watch over each other. I'm a neighbor and I'm seeing issues of violence occurring in my neighbor's home. What am I doing about it? You know, right from the community. When I report this case to the LC, I expect the LC to do something about this case, you know. From the LC, if it's something he cannot manage at his desk, can he refer it to police? There's a whole designated department to handle that, the Child and Family Protection Unit. Now, when it gets to police, I know with all the challenges that you are faced with, can you please accord the necessary attention to these issues that affect the family, you know, so that people do not feel discouraged and lose hope in police. Because we've had scenarios where they say, even when we report issues of child neglect, they have not done much, you know. And then police will also present their issues of lack of funding. They will tell you, in most cases, there is money to go and combat a riot, but there is no money to go and address GBV issues, you know. If you report a GBV issue, they'll say there is no fuel in the car, you know. And this poor lady who has come to report the lady has no money.
Give them money.
Exactly, you know. So can all of us do what we are supposed to do? Can government ensure that this particular area, because it is no secret that the Ministry of Gender, Labour and Social Development is one of the least funded ministries in this country. Can we accord gender-based violence the necessary attention that it deserves? Can we allocate money so that those who are seated in those offices can go down and address the issues that affect women and young girls?
Wow.
This is very important.
Brilliantly done, and I hope the people in power are heeding to this particular call. Now, lastly, Cindy, you're doing a great job, and I think anyone who is watching, they must appreciate your efforts. And you have a report which was issued in 2016, just enumerating the great things you've done. And I think it will be just posted here on screen for people to see what you're doing. What is the plan forward as we wrap up as our partner on this particular show?
At Reach Out Mbuya, we're still in business. We're not closing shop. What we plan to do in the next period going forward is to consolidate our gains. We've transformed very many lives. We've served more than 10,000 clients directly with the much needed services. And as we strive to consolidate our gains, we want to remain the next institution where anybody can walk in to receive services. And that means at the heart of our intervention, we are going to remain the game changer in HIV/AIDS programming. We're also going to consider looking into non-communicable diseases and addressing all aspects that affects the lives of people whom we serve. So
yeah, that's the report
again to highlight, we know that HIV/AIDS has linkage with so many other issues. We talked about violence, but we also know that women and girls have incredible issues that affect them, and empowering these women, taking on to their rights as we press for progress, is something that Reach Out Mbuya cares about. We are a community-based organization. We're a faith-based institution, and all our interventions takes care of an individual looking at the spiritual, emotional, and medical needs. And we'll keep pressing for that and consolidating our gains going forward. Yes.
And on that note, indeed, I just have to appreciate you. You've been such very articulate, very passionate, and brilliant discussants on this particular heavy matter of general national, of course, and international concern. And I wish you a very brilliant, beautiful World International Women's Day tomorrow, Sylvia and Cindy.
Thank you.
Yeah, and send our greetings to all your colleagues at Reach Out Mbuya. And thanks our viewers for keeping with us. These discussions are always structured, and it's in partnership with entities out there. If you're a ministerial agency or a department or just an agency of government, and you want, or an NGO or a corporate entity, please come, talk to us, talk to our MD, talk to our sales team. We'll have a brilliant discussion just as we've had here. And please stay tuned on NTV. I'm Karagaba Baldwins. NTV The Beat is next.